Hey, anatomy students, how are we doing today? I hope you're doing well. We're going to continue on with a little more with the brain structure. Hopefully, you either dissected the brain in my class or you did it virtually. So some of this will make more sense if you get in there and look at the actual brain structure with the sheep brain and understand sheep brain has all the same parts we do. Okay, you're going to see an interesting diagram up here on the screen. And this is why I've separated notes into two parts, because there is so much stuff going on in the cerebrum that I had to do a part two of notes because it'd just be way too much information. We call this the cerebral cortex. It's the thin layer of gray matter that's the outermost portion of the cerebrum, the part with all the wrinkles, the gyrus. That's something you had to find on the brain. So we understand a lot what goes on now in the brain due to our technologies. I'll talk more about that in part two of notes, but our MRIs, our PET scans, our CAT scans have enabled us to be able to look into the brain like we never have before. So we're learning a lot of information about the cerebral cortex, but there's still a lot of mysteries as well. And you can see again all the multiple functions. So I'm going to kind of shelf that, and we'll come back to that when we get to part two of notes, because that's a whole separate test and lesson that we'll get into, and we'll talk about a lot of the stuff that's up here: working memory, auditory, visual, things like that. Okay, great video. I'm not going to play it right now. You can get online and watch this. Her name was Gabby Gifford. She's was a senator from Arizona that some crazy person shot in the head with a gun when she was giving a speech, and it really messed up her speech. And she has really come a long way. But what's interesting, and we'll maybe talk more about this, the other part of notes too, is they actually used, since her left side was the one that was damaged, and that's where your speech is at, they've actually used the right side of the brain through music and therapy to get her to speak again. And she's doing really well now compared to where she was at when it happened. And you might know her too, because she's married to the famous astronaut where they had two identical twins. One went to space and one stayed here, and they compared the two. That's her husband's the one that took over her seat in the Senate, just got elected this year. So kind of a cool story there, and that's a great video that you can click on and watch and see. All right, what I mainly want to focus in on today is the ventricles of the brain, which are the spaces inside or the cavities. They're filled with a fluid called cerebral spinal fluid, which is a clear grayish liquid that circulates around. I'll go over that next. That circulates around the inside of the brain and the outside of the brain. I'm going to show you why it does that. So your brain is not solid. When you dissect it and you look at it, you'll see spaces in there. We call those ventricles. It's like a ventricle in a heart. Okay. So I know that's a bunch of information. So let me break this down a little bit. There's only about 140 mils of cerebral spinal fluid, which sounds like a lot. It's not, because it's going all the way around the inside and outside of your brain, all the way down your spinal cord. So it has to travel a pretty big distance around the body. There's two spaces around the brain. We call them subarachnoid, and around the cord. They're between the arachnoid and the brain. And then there's ventricles and aqueducts that we'll talk about. And then down the spinal cord, there's what we call a central canal. So here's the deal. So where does it come from, and why do we have cerebral spinal fluid? Here's the deal. Cerebral spinal fluid comes from your bloodstream. So as blood passes through a structure called the choroid plexus, which is a network of capillaries that basically filter out all of the red blood cells, the white blood cells. We don't need the blood cells. We just need the plasma and the information. So think of it like a computer that needs data. So we're going to get data from that cerebral spinal fluid is what we're going to do. And it accumulates in something called the lateral ventricle. So let me show you. Okay, you have a color sheet that has this on it. So this is the lateral ventricle. What's in blue. And there's the choroid plexus. So as the blood pumps through your body, it filters through this, and it gets deposited into this cavity, which you found in your sheep dissection. And then we're going to let gravity flow it down to the third ventricle and the fourth ventricles. Okay, so let's go back to that. So it's going to get pulled down from the top down. It's going to go down your spinal cord through the central canal, It's going to go on the outside of the spinal cord and around the outside of your brain, and eventually it gets passes by the medulla, which we'll talk about in just a second. Okay, and we pick up some information from that cerebral spinal fluid. The medulla does, and then it gets drained back into something called the cisterna magna, and back into the bloodstream, and that just is a continuous process. Okay, so if we go back to the diagram, you'll see what I'm talking about. So I got 1, 2, 3, 4. So it actually accumulates here, goes into the third and fourth ventricle, goes down the cord, comes around the outside. If you look at the arrows really close, goes around the outside, and then goes by the medulla, which is right here. Okay, and then we pick up some information, and then we drain it back into something called the cistern, and back to the bloodstream it goes. All right. Now, for the most part, that works really well, and the reason we have to do that is because your body has to know how much CO2 is in your blood. So if I'm running and exercising and breathing really hard, I build up CO2 in my bloodstream, and the body knows I got to get rid of that. It's coming in a lot faster than normal. So we speed up the metabolism, we speed up the heart, we speed up our blood flow, we speed up our respiratory system, and we exhale and we get rid of it, right? If I'm sitting like I'm doing now, I don't have to have my heart beating fast. I do not have to get that metabolism up. So that's when we have low levels of CO2. So as it passes by this medulla, the medulla has receptors in there that pick up this information and make adjustments accordingly. Okay, really important. And the problem is we have some narrow spots. So sometimes when people have traumatic brain injuries or tumors or things like that, meningitis where the membranes swell inside the brain, we can cut off this flow and then everything backs up. Think of a sink that has a plugged drain, and then all the water backs up into the sink, right? And it has no place to go because we're in the middle of the brain, so it's going to put pressure on the outside. So there is some things that we call abnormal conditions that can affect that flow. Most of the time it works really well. But let's say someone has a brain tumor, and it doesn't matter if it's benign or cancerous, it still can have a big effect on the cerebral spinal fluid. And we really worry about if there's a growth in between the third and fourth ventricle, because that's a really narrow passageway. So look at that, right? It's really narrow. Look at the narrow passageway there and up here. If we get any kind of pressure or we push on that, that's going to shut off the flow and give the medulla misinformation, okay? That's called internal hydrocephalus. Hydro means water, cephalus means head. So water on the head or brain is where that term comes from, okay? And they got to go in and put shunts, literally drains in there, and relieve that and get that tumor out of there so a person is normal again. External hydrocephalus is on the outside. So instead of having a growth in the inside of the brain, now we have a growth maybe between the skull and the brain, and that can shut off flow as well, okay? A little different look to a person. Back before we had C-sections and we had treatments, not only did we lose babies to external hydrocephalus, a lot of times we would lose the mom. And childbirth was a very dangerous thing for women back in the 1600s, 1700s, before we got technology like we have now, okay? Blood clots can happen with this. Now, not only do we save babies, we save moms as well. So, because here's the problem with a baby, remember, this is from the skeletal chapter, the skull is not complete yet. It's got space in it and it can expand, and that's what happened. These external hydrocephalus babies got these great big heads. They couldn't fit through the birth canal, and since we didn't have C-sections back then, that caused problems for the baby and the mom. Okay, now not a big deal, and I'm going to show you a disturbing picture. I'll apologize. Well, this first one's not too bad. Here's a look before and after. So here's what your ventricles are supposed to look like in the brain. Here's someone that has internal hydrocephalus. All right, you can see a big difference between the pictures above and the pictures below. There's an autopsy brain of someone that had that. Okay, this is the one that this is what babies used to look like. Not good. They literally had these big heads because all this water and fluid that would build up, or not really water, cerebral spinal fluid, okay? And then it would cause blood clots and things like that. This is a baby that would have looked like this, but now we can C-section them out. We can get them out of the mom. We can put, it sounds kind of bad, but we actually drill, or we put a shunt in and we drain all that fluid off, and those babies can have a normal life then. So thank goodness for technology. I know people complain about, oh, the evil things of technology, but there's some good stuff, especially in the medical field, that come out of it. And there's the function of the cerebral spinal fluid. Yeah, it does give us some protective cushioning, but the main thing is right there. Changes in carbon dioxide content affects your respiration. We can speed it up. We can slow it down. Really important. And I'll leave you with this, and I'm done with notes today, and we'll be caught back up with my classes, so we'll be good to go. But my dad had a really severe brain trauma. He was in a bad car accident. He basically had damage to his left side of his brain, the right side, and it messed up his CSF. So he would go from 150 beats a minute to like 30 in like minutes. And they literally had to take his skull off to relieve that pressure so that he could function. And that was a really long rehabilitation. Last thing, okay, lumbar punctures. Okay, and again, you can watch the video. Lumbar punctures are also called a spinal tap. So what we found is, the good news is your meninges, we talked about the other day, extend down into your back. The spinal cord stops up here. So we found that we can actually it sounds bad, but they put a needle in the back and they can draw off the fluid, and then they can send it to the lab and they can diagnose things like multiple sclerosis, cancer, meningitis, anything, okay? And I'll show you the video real quick. You'll probably get a little bit of an echo in the background, and hopefully it doesn't make it too queasy. If you don't like needles, you may not want to watch this. But the nice thing is we can take this needle in and we can safely draw off fluid that's circulating around the brain and the spinal cord, and we don't have to worry about nicking the spinal cord. We're going into a safe space where there's no spinal cord, and we don't have to worry about it. Okay, so let me show you a person that had this done. Okay.
Hopefully. I have to stop and tell you guys about Lecturio, Lecturio.
Let me get rid of the commercial first.
Essentially an online medical.
There we go. All right, here we go. There's the spinal tap.
Hello, boys and girls. Dr. Carlo Hojer, emergency physician. Finally, the procedure that evaded me for quite a while, a lumbar puncture. Now, again, thank you so much for the patient and the family for allowing me to record this video. This patient had a new onset seizure and had maybe a subacute stroke, but he was having some neck stiffness. So we want to make sure there is no meningitis or bleeding in his head, even though the CAT scan was originally negative. As you can see, I'm using iodine to clean the area. Patient's position is right lateral side. He's a little angulated, but he's a little confused, hard to follow instructions. Nurse getting ready on the backside to help me in case the patient moves or whatever. I'm localizing where I'm going to numb the area. Now we usually use the L4-5 or L3-4 space. We use the iliac crest, the hip bone, to direct us straight down to the spot where we feel the space, and then one space right above that. This is just light acute, so there's no real big importance if the patient moves a little bit or not. We just inject like half a cc just to flare the skin and provide some numbing at the site. Then we go with a bigger needle, longer needle, and thicker needle, and then we withdraw to make sure we're not in a vascular space, and we inject. We go deep, pull back, inject. We go a little deeper, back, inject. And we go the whole length of that needle. That's at least 2 inches deep. Numbing medicine. We use lidocaine 1%, no epinephrine. And just continue that all the way through. Now, this patient was extremely perfect with his case. You could feel the spaces very well. You know exactly where you were going. Here, the patient felt some pain, so we stop, give the medicine some time to work, and then we inject medicine as we come out of that track. The area has been cleansed. This is actually the lumbar puncture needle, the spinal needle, and we use that same space, and we just go perpendicular to the skin, pointing towards the belly button and navel. and I pull back to see if I'm in that space. I haven't gone deep enough, so I put it back in, and I go in a little further, and there it is, a fluid, clear fluid, what they call a champagne tap. You can see right there the water drop just accumulating. Spinal fluid should be completely clear, just like water. It looks turbid or yellow or thick.
Okay, so you can kind of see basically the fluid coming out. It's not red. It doesn't have blood cells in it. And I know that if you don't like needles, you don't like watching that because that needle's super long. But it's a safe procedure, and then we can analyze and tell a lot about that patient from that procedure. All right. So hopefully that makes sense. And if you got, again, like always, got questions, shoot me an email. So we're caught up now, so we should be good to go. So we got just a few more notes, a couple more days of notes, then we'll take our test next week. All right. Hey, have a great day. We'll see you later. Bye.